Desmopressin, also known as Ddavp, is used to control the amount of urine your kidneys make. It is a man-made form of a substance called vasopressin, which is responsible for controlling the amount of urine your body produces. People with water diabetes, diabetes insipidus, certain types of head injury, or brain surgery may not produce enough vasopressin, leading to increased thirst and excessive urination. Desmopressin helps to replace the low level of vasopressin and control these symptoms, preventing dehydration. Additionally, desmopressin is used to control nighttime bedwetting in children. It reduces the frequency of urination and decreases the number of bedwetting episodes. The recommended daily dosage and optimal timing for taking desmopressin should be determined by your doctor based on your specific condition and needs. If you have diabetes insipidus, your doctor may instruct you to take Ddavp 2 to 3 times a day. If you are using it for bedwetting, you will typically take it once a day at bedtime. Children should limit their fluid intake after dinner, especially 1 hour before taking Ddavp until the next morning, or at least 8 hours after the dose. If your child wakes up during the night, make sure to limit the amount of fluids they drink. It's important for all patients taking Ddavp, especially children and older adults, to limit their fluid intake. If you find that you are drinking more fluids than directed, tell your doctor right away. Your treatment plan may need to be adjusted. The dosage of Ddavp is based on your medical condition and how you respond to the treatment. Make sure to take it regularly to get the most benefit from it, and try to take it at the same time each day. If you find that your condition is not improving or that the medication is not working well, make sure to communicate this to your doctor. If you experience headache, nausea, upset stomach, or flushing of the face, tell your doctor or pharmacist. It's important to remember that this medication has been prescribed because your doctor has determined that the benefits outweigh the risks. Many people using this medication do not experience serious side effects. A serious allergic reaction to this drug is rare, but seek medical help immediately if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, contact your doctor or pharmacist. If you're in the US, call your doctor for medical advice about side effects, or report them to the FDA. In Canada, call your doctor for medical advice about side effects, or report them to Health Canada. When taking Ddavp, it is important to be aware of the potential side effects. Rarely, it can cause low levels of sodium in the blood, which can be serious or even fatal. Factors such as drinking too much liquid, using certain medications, being 65 years or older, or having certain medical conditions can increase the risk of low sodium. It is important to have lab tests done before starting this medication and while using it. Make sure to keep all medical and lab appointments. If you experience symptoms of low sodium in the blood, such as nausea, vomiting, headache, muscle weakness/cramps, unusual tiredness, unusual drowsiness, dizziness, restlessness, or mental/mood changes, it is important to inform your doctor right away. In the case of very serious side effects, such as seizures or trouble breathing, seek medical help immediately. Before taking desmopressin, make sure to inform your doctor or pharmacist about any allergies you may have. It's important to also talk about your medical history, especially if you have kidney disease, high blood pressure, heart problems, conditions that may increase your risk of fluid/mineral imbalance, the urge to drink too much water without being thirsty, a low level of sodium in the blood, or bleeding/clotting problems. If you become dehydrated, your doctor will need to correct that condition before starting treatment with desmopressin. It's important to limit alcohol intake because it can interfere with how well desmopressin works. Be sure to tell your doctor right away if you develop any illness that can cause water/mineral imbalance or if you experience conditions that require drinking more fluids. This is especially important for children and older adults. Before having surgery, inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. For pregnant women, desmopressin should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. This medication also passes into breast milk, so it's important to consult your doctor before breastfeeding. When taking Ddavp, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's crucial to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. You should not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Ddavp include tolvaptan and water pills/diuretics such as furosemide. Always consult with your healthcare provider to ensure the safe and effective use of Ddavp. If someone has taken too much Ddavp and is experiencing serious symptoms such as passing out or difficulty breathing, it is important to call 911 immediately. Otherwise, contacting a poison control center is necessary. In the U.S., residents can call their local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of an overdose may include severe or persistent headache, confusion, drowsiness, and sudden weight gain. If any of these symptoms occur, seeking medical help is crucial. It's important not to share Ddavp with anyone else. Your doctor may also want to conduct lab or medical tests, such as urine tests and checking sodium levels in your blood, while you're taking this medication. Make sure to keep all your medical and lab appointments, and consult your doctor for more details. If you take Ddavp once a day and forget to take a dose, take it as soon as you remember. If you don't remember until the next day, skip the missed dose and take your next dose at the regular time. Don't take a double dose to make up for the missed one. If you take Ddavp more than once a day and miss a dose, take it as soon as you remember. If it's almost time for your next dose, skip the missed one and take your next dose at the regular time. Don't take a double dose to make up for the missed one. Make sure to store Ddavp at room temperature, away from light and moisture. Keep it out of reach of children and pets. Do not flush it down the toilet or pour it into a drain unless instructed to do so. When it is expired or no longer needed, make sure to properly discard the product. You can consult your pharmacist or local waste disposal company for more information on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.